Good morning. I have to say I haven't done my 6 or 7 miles just yet, although I think I'm going to have to come back to Las Vegas and stay at the Hilton out at Las Vegas Lake, because those trails out there, just driving by, it's a good thing I didn't go walking this morning because you would have had to come look for me. I am delighted to represent Rear Admiral Nadine Simons, Regional Health Administrator and Assistant Surgeon General in the Office of the Assistant Secretary for Health, Region 9 in San Francisco. Our office is excited to support the Children's Advocacy Alliance in their tireless efforts to ensure every child has a chance to thrive and to make Nevada a better place to live and raise a family. We are gathered here to release the 2014 Nevada Children's Report Card. As we in this room are well aware, the health of children is an indicator of our health and wellness as we mature into adulthood and become engaged members of our society. It is important to note that the report card reveals that Nevada currently ranks last in the nation when it comes to providing health coverage for children. Over 16% of Nevada's children have no health coverage, which is more than double the national rate of 7.5%. However, with the Affordable Care Act and the expansion of Medicaid in Nevada, the release of the report card is a perfect opportunity in which we can raise awareness and educate parents and guardians of children about the importance of getting health insurance, understanding their health coverage, and knowing where to go for care. Both the Affordable Care Act and expanded Medicaid will help families put their health first. Here in Nevada, Nevada Health Link, which of course you are probably well aware, is www.nevadahealthlink.com, has a wealth of resources to find local help to enroll, as well as information on how to use a health plan and how to take advantage of the many preventive services for children and youth that are available at no cost. The preventive services to be covered for children and adolescents include recommended immunizations, behavioral and developmental assessments, iron and fluoride supplements, screening for autism, vision impairment, lipid disorders, tuberculosis, and certain genetic diseases. Similarly, a variety of evidence-based screenings and counseling are required to be covered without cost. And those things, of course, feed back into the school readiness and mental health that was previously discussed. Another indicator of children's health and well-being is childhood obesity. While the grade in this category is better than that of access to health care, there is room to improve the rates of childhood obesity among children in Nevada. According to the report card, Nevada ranks 36th in the nation for the percentage of children whose BMI, body mass index, is at or above the 85th percentile at 33.2%. This is slightly higher than the national average of 31.3%. Nevada ranks in the middle among states for students being physically active, with 55% of students not being physically active and 6.4% not consistently eating vegetables. Again, this data represents an opportunity for cities and towns across the state of Nevada to join Las Vegas Mayor Carolyn Goodman and 459 other local elected officials in the U.S. by joining Let's Move Cities, Towns, and Counties. Let's Move Cities, Towns, and Counties calls upon local elected officials to work with stakeholders to adopt long-term, sustainable, and holistic approaches that promote improved nutrition and increased physical activity, particularly among children in their communities. These approaches align with the pillars of Let's Move, First Lady Michelle Obama's comprehensive initiative committed to reversing the childhood epidemic within a generation. In 2009, when this initiative was launched, 1 of 3 children was overweight or obese, a condition that places them at greater risk of developing diabetes, heart disease, and cancer over the course of their lives. This is not the future we want for our children, and it is a burden our healthcare system simply cannot bear. As we know, obesity is the second leading preventable cause of death among adults. Once again, the report card provides a roadmap of opportunities for all stakeholders across the state to join forces to improve the health, well-being, and readiness of children in Nevada. Collaboration, innovation, and partnership are what will move the dial on these health indicators, and it is the creativity and energy of individuals and organizations, such as the Children's Advocacy Alliance, that will make a difference. By supporting priority projects and policies, and helping to encourage and nurture new ideas, together we can ensure that the next report card is straight A's. We appreciate your commitment to public health, and you can count on our office to be an engaged stakeholder in your endeavors to improve the lives of families and children throughout the state of Nevada. And finally, I'd like to read to the audience a letter that was sent to Denise and her staff at the Children's Health Alliance. It's from the White House, dated January 8th, 2015, and it reads, "Thank you for taking the time to promote health and wellness in your community. I am always encouraged to hear about this important work being done across our country. As you know, improving the health of our next generation is one of my defining missions as First Lady. That is why we launched the Let's Move initiative to help ensure all Americans have the basic nutrition they need to learn, grow, and succeed. By supporting parents, providing healthier foods in schools, helping kids to be more physically active, and making sure all families have access to affordable and healthy food, we can help our children live full and active lives. I truly believe our strength as a country and our ability to responsibly shape our future depends on solving this challenge, and people like you are vital to our success. We need your ideas, your hands, and your heart to lead us to a brighter, healthier tomorrow. Again, thank you for all that you are doing, and please remember to stay connected with our efforts and share your success stories at www.letsmove.gov. I wish you all the best," and it's signed by Michelle.